For years, advocates of adults with developmental and intellectual disabilities warned state leaders of a growing crisis in the community, stagnant wages, and a short supply of home health aides who help give those residents quality of life. Well, the dwindling workforce was made worse during the pandemic, and families are pleading with lawmakers to make bigger investments in the population. Joanna Gagis has the story.
The participants that we support here have varying disabilities. Down syndrome, there's individuals with autism, cerebral palsy.
Easter Seals is a highly regarded day habilitation program for folks with disabilities. They, like many others in the field, are struggling to stay afloat.
There are a little under 13,000 individuals, individuals with intellectual and developmental disabilities who are currently in day habilitation programs. And these programs provide them with opportunities to acquire skills and experiences to participate in the community.
But they say COVID's been the straw that broke the camel's fiscal back. They're reimbursed on a fee-for-service model, which meant they went years without appropriate funding as clientele stayed home.
95% of My Day Hab programs are open. But remember, this is a fee-for-service system. They don't collect revenue unless people are coming in. And according to my surveys, they're only operating at 62% of their pre-pandemic level.
The state did add $9 million in reimbursements for programs like this statewide in the current fiscal budget. But Matt Binder says it's not enough and points to American Rescue Plan funds that can help close the gap.
We need a recurring commitment in the rates we get reimbursed at to rise with the costs we see. So this year we think that's about $17 million, but each year, with whatever inflation is, we really need to see that cost of living increase.
And while, yes, the American Rescue Plan funds have given the state more flexibility to support organizations like Easter Seals, they're not the only ones asking for a piece of the pie. So how do legislators decide who gets a piece?
We've got to make sure every dollar is spent smart, and it's an investment, and it's not easy to do this in a responsible way. In fact, the state of New Jersey is sitting on a lot of money, billions of dollars from the federal government right now, but that's a one-time thing.
And this funding request is for recurring increases. Nevertheless, Senator Vin Gopal, who toured the Oakhurst site to see it back in action, says he supports the move.
It has to be prioritized, and unfortunately, we've got to make sure nobody gets forgotten. So that's why I think this is so important that they're doing this. But we're advancing increased funding in mental health, special education, adult daycare, so many other areas. I mean, we just saw the state put out $54 million for child care facilities. This is an equally important industry that the state needs to focus some funding and resources on.
And the issue has bipartisan support. Republican Assemblywoman Kim Ulner also visited the location to lend her voice to the cause.
These people, even though they're over 21, should not be left behind. They need to have as many funds, if not more, as possible to keep them be vibrant parts of our communities, and they're being disadvantaged, and I think releasing funds to Easter Seals and other related type programs like this is imperative.
There's a pair of bills in the Assembly and Senate that would increase the reimbursement rates. Both Gopal and Ulner expressed their support for them. Kathy Chin says any infusion of money, even if it's a one-time injection from the American Rescue Plan funds, would have a huge impact.
If they can be released so that our providers can use them to incentivize staffing, recruitment and retention of staff, pay for overtime, what that can do, Joanna, is we believe it can give the programs a bit of a jolt, if you would. Could get more staff in, could get more people in, more revenue in, and then repeat. It's not going to solve it. It's not a long-term solution, but it can get us going
to meet the needs of more individuals who are often left out of the day-to-day of society, but who so desperately need the support. For NJ Spotlight News, I'm Joanna Gagis.
That does it for us this evening, but